If you or someone you love had a stroke and now speech sounds slurred, hard to understand, or just like the words are running together, then you're not alone. Speech therapy for stroke patients with slurred speech, often called dysarthria, focuses on retraining the breath support, the timing, and the articulation. And if you practice the right way, your clarity can improve. Today, I'm going to walk you through 5 different exercises that you can start using right away. So let's get to it. The first exercise focuses on the breath support. Clear speech starts with steady airflow. After a stroke, breathing can become shallow or uncoordinated, and that makes speech sound weak, rushed, or inconsistent. Here's how to practice. Start seated upright with both feet on the floor. Take a slow breath in through the nose, then exhale slowly while saying aloud, ah. You want to keep that sound smooth and even, and try not to fade out too quickly. We're aiming for control here. Do it 5 to 10 times, and here's the progression. Once the ah feels steady, try saying short words in one controlled breath. For example, cat, dog, book. One breath, one word, slow, clear, intentional. This exercise is training steady airflow and coordination between breathing and speech. That control becomes the foundation for clear sentences later. The second exercise we're going to focus on is over-articulation. After a stroke, the lips and tongue may move, but not fully. Speech becomes smaller, softer, and less defined. So we do the opposite. We make the movements bigger. Here's how to do this one. First, pick a short and simple sentence like I need help or I'm hungry. Now say it slowly and exaggerate every sound. When doing this exercise, make sure to open your mouth wider and overpronounce each of these consonants. Make the movements obvious. It should feel dramatic. You can also practice this pattern, pa, ta, ka, slowly, with clear separation between each of the sounds. The pa trains the lips, the ta trains the front of the tongue, and the ka trains the back of the tongue. So do 5 to 10 of these slow repetitions, and then go back to the short sentence and apply that same exaggerated clarity. Big movements, clear sound, and slow pace. When articulation gets bigger, speech gets clearer. And once clarity improves, you can gradually increase speed later. So now let's work on controlling speed directly. This is the third exercise, and this is rate control. Slurred speech often becomes harder to understand when someone talks too quickly. When speech speeds up, the muscles don't have enough time to coordinate clearly. So we train the opposite. We slow it down on purpose. Here's how to practice. Pick a short sentence like I need water or I'm ready. Now say that sentence slowly and pause slightly between each word. So for example, I need water. Let each word finish before starting the next one. Now this may feel a bit exaggerated at first, and that's okay. We're retraining timing here. And if you want, you can also use a pacing cue when doing this exercise. And you're just going to tap your finger for each of the words in that phrase. So for example, I need water. That physical rhythm helps control speed and prevents rushing. So start slow, focus on clarity, and as coordination improves, you can gradually smooth it out. But clarity comes before speed. Even a small reduction in your rate of speech can significantly improve speech intelligibility. Now let's combine breathing and articulation into full sentence control. This fourth exercise brings everything together: breath, articulation, and pacing. Now we can apply it to real speech. Pick a short functional sentence, something they would actually say during the day, like I need to sit down, or please pass the remote. So before speaking, take one steady breath in. Then say the full sentence slowly on one controlled exhale. We're looking for big articulation and clear sounds here. Slight pause between the words if needed, but focus on finishing the sentence clearly, not quickly. If the sentence feels too long, shorten it and build gradually. You can even record the sentence on your phone and playing it back, because hearing the difference can help reinforce your progress. On this one, start with 5 repetitions, and then rest, and then repeat for another set. And again, this exercise trains coordination across the entire speech system. Breath control supports volume, and big articulation supports clarity. And when those 3 work together, intelligibility improves. On to the last exercise, which is sound precision. Sometimes slurred speech happens because similar sounds blur together. For example, bat and pat, tea, key, fan, and van. These are called minimal pairs. words that differ by just one sound. So here's how to practice this. Pick a pair and say the first word slowly and exaggerate that first sound. Bat. Then say the second word. Pat. Make the difference obvious and focus on clear, distinct mouth movements. Repeat this back and forth for 5 to 10 times. This trains the muscles to differentiate sounds precisely. It improves clarity by sharpening articulation at the sound level. So start slow, stay deliberate, and focus on precision first, then smoothness. Now let's talk about frequency. Short sessions work best, but short doesn't mean once a day. Think in small blocks, 3 to 5 minutes, 2 to 5 times a day. And this is often much more effective than one long, exhausting session. Speech clarity improves with frequent activation, not intensity alone. Consistency matters more than duration, and just make sure to stop before fatigue sets in. While speech clarity is important, it's only one piece of the puzzle. We still have breath control, coordination, attention, endurance. These are all connected, and progress happens fastest when recovery is structured. So if you want a simple step-by-step way to understand what stage of stroke recovery you're in and what to focus on next, I'll put together a free 5-minute recovery roadmap. This roadmap walks you through the stages of stroke recovery and shows you how to train strategically. You can download it in the description below, and again, it's free and it's only trying to help you progress faster. If this was helpful, then subscribe, because I break down stroke recovery exactly like this in practical ways you can use at home.